Brain fog? It could be one of these 4 senior supplements. What if the pills meant to help your brain were the ones clouding it? That's a question more seniors should be asking. Millions of Americans over 60 report the same symptoms: slow thinking, scattered focus, and short-term memory issues. It's often blamed on age. But in many cases, the real cause is overlooked. A 2022 review found that over 1 in 3 seniors experiencing brain fog were taking supplements that may interfere with cognitive clarity without even knowing it. These aren't obscure pills. They're popular, easy to buy, and even labeled as senior-friendly. But depending on dosage and health status, they may be quietly doing harm. This video will uncover 4 common brain support supplements used by older adults that may be contributing to mental fog. One of them might already be in your cabinet. High-dose vitamin B6, brain support or hidden neurotoxin. Vitamin B6 is often praised for its role in nerve health and brain function, especially in supplements marketed to older adults. But what many don't realize is that high doses of B6, taken daily over time, may do more harm than good. When taken in excessive amounts, vitamin B6 can cause peripheral nerve toxicity. This means it may interfere with how the brain and body communicate, leading to symptoms like tingling in the hands and feet, reduced reflexes, and most notably, persistent brain fog. Some popular supplements in the U.S., such as Super B Complex and certain memory support formulas, contain 100,000 to 200 mg of B6 per dose. That far exceeds the recommended upper limit of 100 mg per day, and unlike water-soluble myths suggest, the body doesn't always eliminate the excess harmlessly. A 2021 study published in Neurology found that adults taking over 200 mg of B6 daily for more than 6 months had a 5-fold increase in the risk of nerve-related symptoms. These included slowed thinking, sensory numbness, and difficulties with coordination and memory. Margaret, a 68-year-old from Ohio, began taking a daily B complex to support energy and cognitive clarity. Months later, she noticed numbness in her toes and trouble recalling names. Her doctor found elevated B6 levels in her blood work and advised stopping the supplement immediately. One of the biggest misconceptions is that since B6 is water-soluble, it can't build up in the body. But in seniors, especially those with slower metabolism or impaired kidney function, accumulation is not only possible, it's well documented. The problem becomes worse when seniors take multiple products simultaneously. A multivitamin labeled for seniors, plus a separate brain supplement, plus a joint product, all can contain B6. When combined, the total dose can unintentionally climb above safe levels. Those on medications such as diuretics, diabetes drugs, or treatments for Parkinson's disease may also be at higher risk. These medications can alter how B6 is absorbed or processed, increasing the likelihood of side effects even at moderate doses. If you've been experiencing persistent fatigue, poor focus, or strange sensations in your limbs, it may be worth reviewing your supplement labels. Don't just look at the front. Turn to the back and check the exact B6 content per serving. Most importantly, avoid self-prescribing high-dose B-complex vitamins just because the label promises brain support or nervous system health. Effective and safe use of B6 requires lab monitoring and tailored recommendations from a qualified health professional. Sometimes, the very pills we trust to support our memory are quietly impairing it. And if that's happening in over a third of older adults taking high-dose B6, It's a trend worth paying close attention to. But vitamin B6 is just one piece of the puzzle. Several other well-known senior supplements, often taken without question, may also be affecting mental clarity in surprising ways, and one of them might be in your cabinet right now. Ginkgo biloba, brain booster or source of cognitive disruption. Ginkgo biloba is one of the most popular herbal supplements among older adults in the United States. It's widely marketed as a natural solution for improving memory, boosting circulation, and supporting overall brain health. But despite its reputation, long-term or inappropriate use may contribute to the very symptoms it's meant to relieve. This extract, derived from the leaves of the ginkgo tree, has shown modest benefits in specific cases of age-related cognitive decline. However, those benefits typically appear at controlled doses, between 120 to 240 mg per day, and only when used under medical guidance. Higher doses or prolonged use without monitoring may lead to unwanted neurological effects. Clinical reviews have reported that some individuals taking ginkgo experience headaches, dizziness, restlessness, and even insomnia. These symptoms are often subtle and may be mistaken for aging or stress. But in reality, they can signal that the supplement is affecting the brain's chemical balance and circulation patterns. Another concern is how ginkgo interacts with common medications. It can increase the risk of bleeding when combined with anticoagulants like warfarin, aspirin, or even over-the-counter anti-inflammatories. It may also alter how certain blood pressure or antidepressant medications are metabolized, affecting their effectiveness or side effect profile. Many seniors take ginkgo continuously for months or years without pause. However, most clinical studies recommend using it in limited cycles, typically no longer than 12 weeks, followed by a break. Prolonged exposure may disrupt neurotransmitter systems or reduce sleep quality, both of which can impair memory and concentration over time. Additionally, not all ginkgo products are created equal. Some over-the-counter formulations contain inconsistent or unstandardized extracts. This can lead to variability in potency, making it difficult to predict how the body will respond, especially for individuals with sensitive nervous systems or multiple health conditions. Despite its natural label, ginkgo biloba affects multiple systems in the body, including vascular tone, platelet function, and neurotransmission. For aging adults with slower metabolic clearance, even standard doses may accumulate or interact unpredictably with existing health issues or prescriptions. One study published in the Journal of the American Geriatric Society found no consistent cognitive benefit for healthy older adults taking ginkgo over a long period. In some cases, participants reported increased confusion and anxiety after continuous use. These side effects reversed only after stopping the supplement. The bottom line is this: ginkgo biloba is not inherently dangerous, but it is not universally safe. Its effects depend on dosage, duration, health status, and concurrent medications. Without supervision, what begins as a memory aid may gradually turn into a source of fogginess or mental fatigue. Before continuing or starting ginkgo biloba, older adults should consult their physicians, especially if they are on blood thinners, sleep aids, or medications that affect the brain or circulation. Annual medication reviews are also a good opportunity to reassess whether this supplement is still appropriate. Cognitive decline is not always due to aging alone. Sometimes the very substances intended to support brain health are quietly interfering with it. And while ginkgo remains a staple in many senior supplement regimens, it deserves closer scrutiny. As we continue, we'll explore another common supplement, one that's often praised for heart and brain benefits, yet may contribute to slowed mental clarity when used without caution. Omega-3 fish oil, heart-friendly but not always brain-clear. Omega-3 fatty acids, particularly EPA and DHA found in fish oil, are widely praised for supporting cardiovascular health. For older adults, they're often marketed as a dual benefit, protecting the heart while enhancing cognitive function. But when used in high doses or combined with certain medications, fish oil may produce unintended neurological effects. While moderate intake of omega-3s is generally considered safe and beneficial, excessive consumption, typically more than 3 grams per day, can alter the brain's signaling mechanisms and slow down mental processing. This may contribute to symptoms such as sluggish thinking, reduced focus, and persistent fatigue. Research has shown that high-dose omega-3 supplementation may influence serotonin and dopamine pathways in the brain. In some individuals, this shift can lead to a dampening effect, causing a mild but noticeable decline in clarity, energy, or mental alertness over time. Compounding the issue, many triple-strength fish oil products contain highly concentrated doses of EPA and DHA. When taken without awareness of daily totals, users may unintentionally exceed recommended levels, especially if also consuming omega-3 rich foods or other supplements. In seniors taking medications like blood thinners, antihypertensives, or antidepressants, the interaction between omega-3s and the central nervous system can become even more complex. Some studies suggest increased risk of low blood pressure, sleep disturbances, or cognitive dulling when fish oil is layered on top of existing therapies. Moreover, omega-3s affect fluidity in cell membranes, including neurons. While this has benefits in proper doses, prolonged high exposure may disrupt the fine-tuned balance of electrical and chemical activity within the brain, particularly in aging adults with slower adaptive responses. A study published in JAMA Internal Medicine found that participants over 65 who supplemented with more than 2 grams of omega-3s daily showed no significant cognitive improvement compared to placebo and reported higher rates of tiredness and mental lethargy. It's also worth noting that not all fish oil supplements are pharmaceutically purified. Some over-the-counter versions may contain oxidation byproducts, which can contribute to systemic inflammation rather than reduce it, paradoxically increasing the risk of mental fog and vascular stress. Another common misconception is that more is better. But unlike vitamins with clearly defined thresholds, omega-3 needs vary widely based on diet, health status, and medication profile. What benefits one person may burden another, particularly in older age when physiological responses are less predictable. Older adults should also be aware that fish oil is not a quick fix for memory or cognitive speed. Its primary evidence-based role remains in managing triglycerides and supporting heart health, not enhancing short-term brain function. Any mental boost is likely modest and indirect. For seniors already eating fatty fish several times a week or consuming fortified foods, adding concentrated fish oil capsules may tip the balance toward excess. Regular lab testing and medication reviews are essential to ensure that omega-3 intake remains within a safe and beneficial range. In the end, fish oil can be part of a healthy routine, but only when its use is personalized and carefully monitored. For those experiencing unexplained brain fog or daytime fatigue, reevaluating omega-3 dosage may be a critical step. Coming up next, we'll examine a common mineral supplement often taken for muscle or bone support, yet capable of clouding mental clarity if consumed in excess or in the wrong form. Magnesium supplements, gentle mineral or mental haze. Magnesium plays a vital role in muscle function, bone health, and nerve regulation. Because of this, it's a common ingredient in many senior supplements. However, not all magnesium is the same, and when taken in certain forms or at high doses, it may contribute to brain fog and cognitive slowdown. Among older adults, magnesium oxide and magnesium citrate are frequently used to ease constipation or promote relaxation. These forms are affordable and widely available, but they also absorb quickly and, in high doses, may disrupt the body's electrolyte balance and neurological stability. Too much magnesium can interfere with neurotransmitter activity, leading to symptoms such as fatigue, slowed reaction times, difficulty focusing, and sleep disturbances. These effects may be subtle at first, but become noticeable when supplements are taken daily without monitoring. A 2022 study in the American Journal of Clinical Nutrition noted that high supplemental magnesium intake was linked with reduced performance in short-term memory tasks among seniors. Researchers pointed to altered calcium and sodium transport across nerve cells as a possible mechanism. Unlike dietary magnesium from leafy greens or nuts, supplemental forms bypass natural digestive buffering. This can overwhelm the nervous system's delicate chemical environment, especially in older adults with slower metabolism or impaired kidney function. For example, Helen, a 71-year-old from Arizona, began taking 400 mg of magnesium oxide each evening for muscle cramps. After several months, she noticed frequent drowsiness during the day, poor concentration, and vivid dreams disrupting her sleep. A medication review revealed her magnesium intake exceeded recommended limits, leading her doctor to adjust the dose and switch forms. Magnesium also interacts with medications commonly prescribed to older adults, including diuretics, heart rhythm drugs, and some antacids. These combinations can either increase magnesium absorption to unsafe levels or mask symptoms of excess until they become more serious. The tolerable upper intake level for supplemental magnesium is 350 mg per day, according to the National Institutes of Health. However, many seniors exceed this unknowingly, especially when taking separate bone support formulas, sleep aids, and multivitamins simultaneously. Moreover, not all symptoms of magnesium excess appear physical. Cognitive effects such as slowed thinking, forgetfulness, or morning grogginess are often dismissed as part of aging, but may in fact signal mineral imbalance. In some cases, the form of magnesium makes all the difference. While oxide and citrate absorb rapidly, forms like magnesium glycinate or malate are gentler on the nervous system and less likely to cause mental dullness when taken appropriately. Healthcare professionals recommend periodic reviews of all supplements, especially when symptoms like fatigue, confusion, or disrupted sleep patterns emerge. A simple blood test can help determine magnesium levels and guide safer dosing decisions. Magnesium remains essential to health, but like all nutrients, it must be balanced. For seniors especially, more is not always better, and certain forms may cause more harm than good if used without awareness. If you've been feeling mentally sluggish despite good sleep, hydration, and diet, it may be time to take a second look at your supplement cabinet. The source of the fog might not be age. It could be a well-intentioned tablet taken at bedtime. As we wrap up, we'll review what all these supplements have in common and how small adjustments could help restore the mental clarity many seniors believe they've permanently lost. If you've been experiencing persistent mental fog, reduced focus, or slowed thinking, the cause may not be aging alone. In many cases, over-the-counter supplements, marketed specifically for seniors, may be quietly contributing to cognitive disruption. This video examined 4 commonly used supplements that, when taken at inappropriate doses or without proper supervision, can interfere with brain clarity. Each of them is legal, accessible, and often misunderstood as completely safe. The takeaway is clear: supplements are not risk-free. Older adults should regularly review all products they're taking, including multivitamins, sleep aids, memory boosters, and mineral blends, and cross-check them for cumulative effects. A practical next step is to schedule a supplement review with a physician or pharmacist. Request lab work where appropriate, especially if you're using high-dose B vitamins, omega-3s, or magnesium regularly. Adjusting the form, dose, or frequency could make a noticeable difference. Avoid layering multiple supplements that target the same system, such as nervous function or circulation. Read labels carefully and check for redundant ingredients, especially in products labeled senior formula or brain support. If you're unsure whether your current regimen is helping or hindering, consider taking a structured break from non-essential supplements under medical guidance. Tracking symptoms during this period can help isolate what's truly beneficial. For evidence-based insights on aging, supplements, and health strategies tailored for people born in the 1900s, subscribe to Health 1900s. Our content is focused, practical, and built on verified research, not trends or marketing claims. Disclaimer: this video is for general informational purposes only and does not replace professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider before making changes to your supplement routine.